Hello all, welcome back to BNYS Medicine. So today we'll be seeing about the Herring's law of cure. So basically Herring's law of cure comes under iris diagnosis, which is one of the main topic in the naturopathic diagnostic methods. And like talking about the law, it plays a significant role in the homeopathic medicine, but as well as is applicable to naturopathy also. So the law is proposed by Dr. Constantine Herring, a German homeopathic physician, and the law can be mainly divided into some parts. Okay, we'll see that. So what does the law basically tells? The law tells that the cure takes place from above downwards, from within outwards, the more important organ to the less important organ, and in the reverse order of the appearance of the symptoms. So as you can see here, we can divide or classify the law. For the ease of studying, we can divide into four parts. That is, first one above downwards, second within outwards, third from the more important organ to the less important organ, and fourth in the reverse order of the appearance of the symptoms. This law tells about the direction of the cure. As we all know, there is direction of cure and direction of disease. As like is this law talks about the direction of cure, it's also called as the law of direction of cure. It's like common only. If question comes as like explain the direction or like law of direction of cure, it basically means Herring's law only. The picture given in this slide is a like pictorial representation or chartwise representation of the law. As you can see here, there is like two lines or two arrow marks, one suggesting the direction of suppression and another suggesting the direction of cure. If you take a close look into the picture, you can see different levels, and in the direction of suppression or like how the suppression occurs is, first the skin is being suppressed, and then the musculoskeletal system, alimentary, urinogenital, respiratory, endocrine, cardiovascular, immune system, central nervous system, and next to the ultimate level, that is the mental and emotional suppression also takes place. So this is the way how the suppression takes place in a disease process. So hence by like when the cure takes place, the direction of cure will be just opposite from that, and we'll be like talking about in the further coming slides while discussing about the four parts of the law. Let's move on to the four parts. First, from above downwards, we'll try to discuss about this law and the like parts connecting to some diseases process, like some disease or examples kind of things. First, from above downwards, the annihilation of the symptoms will take place from proximal anatomical part to distal anatomical part of the body. Symptoms disappear from axial part to the appendicular part of the body. And here the example given is polyarthritis case. Okay, here the law talks that the symptoms, like annihilation of the symptoms, will take place from the proximal part, and it will like again go to the distal part. It's like basically from above on to downwards, it will be like the cure will be taking place. And the polyarthritis case here like talks about like polyarthritis means arthritis arthritis of the numerous joints of the body. So when like given proper treatment or like proper cure methods, the cure of the disease or the polyarthritis takes place in a way that the parts or the joints which are proximal will get cured first compared to the distal parts of the body. Moving to the second part, that is the cure takes place from within to outwards. For me personally, this classification is very much what likely to me because there's a reason I'll be talking about. The law here tells that the disease process first starts in the internal man or the vital force. What is vital force, or also called as chi in acupuncture or prana in yoga? So this vital force or the like basic vital energy which is required by a person or like by a human being or any other things to live, this will be getting affected first in the disease process. So this disease process basically first starts in the internal man, that is the vital force, and then the disease is reflected onto the outer man, anatomical organs. uh, we very well can, like we, especially the BNYS graduates, can very well connect with these things, because in yoga also we'll be studying that will be affecting, the prana will get affected first, and then it will be reflected in the outside of the body. Here, that is the derangement starts in the vital force only. Symptoms of the disease are the outward reflected picture of internally deranged vital force. A very good explanation given, or a very good sentence given here. Please note, symptoms of the disease are the outward reflected picture of internally deranged vital force. Okay, whatever the derangement or like imbalances in the vital force, that will be reflected as disease in the external man. Coming to the next slide, the curative process in the nature is from center to periphery. See, the reason why I like this perspective, or like I like this concept more, is because of this reason. Whenever we take some treatments, or like if you can see in patients like in the hospitals and all, they'll be taking some treatments, and they'll be telling that, okay, I feel so good inside, like I feel happy. What is that thing like makes them like feel happy inside? They'll be telling like, okay, I feel so good inside. See, that is the reason why the patient feels better in his inner self in spite the existence of the disease in physical parts. See, like the patients will be having disease, if their disease might not be like cured completely, but then also they'll be feeling somewhat pleasant or like good experience in their like inner self. This is the reason why it happens. So the cure will takes place in the right, if it is in the right direction, it will takes place from within outwards. Here the example given is the patients with complaints of both respiratory as well as skin disorder, and in the case of rheumatic fever also.